My name is Will Skoog. I am an optometrist. I am a faculty member and an assistant professor of optometry at the Illinois College of Optometry in Chicago. I presented a poster at the PFLS meeting this past January on a patient that I saw in our clinic who had 2 full-thickness corneal transplants and then had one lamellar transplanting a D-section. She had a very compromised eye. She also was aphakic, so had a very high prescription and was unable to see out of that eye really with any type of correction. So she presented seeing what options she had. She's always complained of like headaches and just out of sorts, didn't feel very comfortable visually. I ended up fitting her in a BostonSight SCLERAL lens. Her cornea was very, very compromised and had already had a little bit of swelling and edema in her cornea. But this was really the only option that we could pursue. She had 4 smart panels that were put in. Her corneal thickness profile never really changed. Once we got her in this lens, she was definitely much more of an outgoing person and felt like she could navigate her home environment. When it came to, doing this patient's fitting, the lens profile was over 800 microns. I had to work with the consultation team along with using the Fit Connect software just to make sure that I was making the appropriate changes, but that I could work with the lab on the other side of it to make sure that we were able to, try and get that center thickness down so it wasn't just a big, heavy lens and uncomfortable for the patient. When I first fit her in this contact lens, I didn't put the smart channels in initially, even just from first putting that lens on with no smart channels to then adding the smart channels after that first visit. It was a night and day improvement in terms of how comfortable she felt with the lens and also just the amount of tear exchange we were able to get underneath there to make sure that we weren't causing any further compromise to her corneas. Definitely consider going with a BostonSight SCLERAL lens because of some of these technologies like the smart channels and illustrations that can be put in. It's just because we need to make sure that we are giving as much attention and love to these corneas as we can so that we don't cause further problems down the line by trying to correct and improve their vision. Sometimes it's a fine line. Your lab consultants are always going to be your best friends. They will help show you what is possible with their lenses and how they can maximize their designs so we can make sure our patients are successful. When we have technology like the BostonSight SCLERAL lens, they go above and beyond in trying to help make sure that the patients who have highly compromised eyes or these very challenging cases can be fit successfully with a diagnostic SCLERAL lens.